7 between 96.
All right, all right. You're about to order some assessments for you today. So I'll be doing a respiratory assessment, cardiac assessment, neurological assessment, musculoskeletal assessment, safety, pain, and an HEENT, which is head, eyes, ears, neck, and throat assessment. Okay. First, I'm going to start with your respiratory assessment. Do you smoke?
No.
Do you have shortness of breath?
No.
All right. So I'm going to listen to your lungs. Let me get you to lift up your shirt. And I'm just listening for normal sounds. Alright, so first I'm going to start with your left upper lobe. Then I'm going to go to your right upper lobe. Then I want to go down to your right lower lobe. Alright, now I'm going to go to your left middle lobe. Alright, and now I'm going to go down to your left lower lobe. Alright, now I'm going to do your back. Let me get you to turn around. Let me get you to fold your arms for me. Alright. Your left upper lobe. Right upper lobe. Right lower lobe. Left middle lobe. And left lower lobe. Alright. All your lungs are clear. Now I'm going to get you to, let me get you to take a deep breath in and then cough. Alright, this just helps to keep your lungs clear from any fluid that can decrease your risk for pneumonia. I just want to let you know when you're laying down, let me get you to turn every few hours just to keep your lungs clear. I'm going to bring you back an intensive spirometer. It's a breathing thing. It's a breathing tool to help you strengthen your lungs. You'll take a deep breath in and see how long you'll hold it. I'm going to bring it back. I want you to at least try to use it 10 times an hour, okay? Alright, so now I'm going to start with your cardiac assessment. What I'll be starting with first is checking your jugular vein distension. Alright, let me get you to lean back at like a 45-degree angle. There you go. And I'm just going to check. Alright, that looks good. So now I'm going to be checking your heart, listening to your heart. Do you take any heart medications?
No.
Do you have any chest pain?
No.
Alright, and I'm going to be listening with my diaphragm side of my stethoscope. You use the bell side of your stethoscope for patients who you may think have a heart murmur. Let me get you to lift up your shirt for me. Alright, so first I'm going to start with your aortic intercostal space. And now I'm going to go to your pulmonic. And now your Erb's point. And tricuspid. And now mitral. Alright. Now I'm going to be checking your skin for any discoloration or in temperature. And what I'm looking for is coldness of the skin and then any discoloration. Alright, so now I'll be palpating your pulse. Palpating your, what is this? Your fingers, your capillary refill, and then I'm going to be palpating your lower and upper extremities for edema. So let's start with that. We're going to start with your capillary refill. And what I'm looking for is just to see how fast your blood returns back into your fingertips. So I'm going to do both fingers, both hands. And we're also going to do your toes as well. Alright, so now I'll be doing palpating your upper and lower extremities. And I'm just going to push on the skin to see if there's a dent there when I let go, to see how fast the skin bounces back. We just be checking for any edema. And now I'll be doing your legs. Get your feet. Okay. And now I'll be palpating your pulses. I'll do your radial pulse. I'll do your posterior tibial and your dorsalis pedis. There are other pulses you can palpate, such as your carotid, which is in your neck, your popliteal, which is behind the knee, your brachial, which is on the arm, and then you have your axillary, which is under the arm, and then you have your femoral, which is in the hip here. All right, so I'll be taking your radial first. Posterior tibia. And take your slide off. And now your dorsalis pedis. Right. Side. Alright, pulse normal, regular. Alright, now I'm going to start with your safety assessment. Do you have a history of falling?
No.
Alright, let me get you to get up and just walk across the floor for me in a straight line. Alright, good job. Have a seat for me. Let me get you to re-walk. Alright, good job. Have a seat. Alright, so now let me get you to hold your arms up. We're just going to check your gait. Alright, good job. I'm going to be doing the 4 P's of safety. Do you have any pain? Alright, do you have to go to the bathroom? You need to be repositioned. Alright, and I'm going to give you your call light. This is, if you need anything, just push that button. We'll help you. I'm going to make sure your bed is lowered down to the floor and your side rails are down. I'm going to make sure there's nothing on the floor for risk of fall. Alright, do you need any personal items for me to get you? Alright, so now I'm going to be doing your neurological assessment, okay? So we're going to ask, do you have any brain injuries, loss of memory, or any confusion? Alright, so I'm going to be assessing your level of consciousness and orientation by asking you some questions. Alright, so who is the president?
Joe Biden.
Alright, where are you?
Macon, Georgia.
Alright, what year is it?
2022.
Alright, and what did you have for breakfast this morning?
Waffles.
Alright, now I'm going to be explaining the Glasgow Coma scale. It's a scale, and it's used to access the level of consciousness based on eye opening, verbal response, and motor response. And a normal range for this scale is 13 to 15. Anything less than 8, that indicates brain injury or brain damage. Now I'm going to start with your musculoskeletal assessment. Do you have any joint pain?
No.
Alright, so now I'm going to be checking your range of motion of 2 of your upper extremities and 2 of your lower extremities. I'll also be checking for strength as well. So my 2 upper extremities, I'm going to do your elbow and then I'm going to do your wrist. So let me get you to flex your wrist. Good job. And you're going to extend. Alright, and hyperextend. Good job. Let me do the other one. So you're going to flex, extend, hyperextend, and now I'm going to be checking your strength. So let me get you to flex your arm against my hand. Good job. And now extend. Good job. This one too. Let me get you to flex against my arm. Hyperextend. Good job. Now I'm going to be doing your wrist. So let me get you to flex, extension, hyperextension. Let me get you to flex, extension, hyperextension. All right? Let me get you to flex, extend, hyperextend. All right, now I'm going to be checking for strength. So let me get you to flex your hand against mine. Now extend your hand against mine. Good job. Same on this side. Let me get you to flex yours against my hand. Now extend. Great job. Now for the 2 lower extremities, I'll be doing your knee and then your ankle. So I'm going to ask you to flex your knee backwards. You're going to extend it regular and hyperextend it out. So let me get you to flex, extend, hyperextend. Good job. No crackling, sounds smooth. We get you to flex, extend, hyperextend. Good job. And now I'll be doing the same thing with strength. So let me get you to flex your leg against mine. Flex. All right. Extend. Good job. Hyperextend. That's hyperextend. Now let me get you to flex again against my hand. Hyperextend against my hand. Good job. Now I'm going to be checking your ankles. So I want you to press your feet forward. So I want you to press your feet forward like you're pressing the gas pedal. Good job. And that's called a plantar flexion. All right. And dorsiflexion, flex it up. Good job. And now I'm going to be checking for strength. I want you to plantar flex with my hand. Now dorsiflex. All right. Now we're going to be doing the same thing on the other side. So I want you to plantar flex. Good job. Dorsiflex. Plantar flex against mine. Dorsiflex. All right. Good job. Alright, so now that that is done, let's see. Now I'm going to be checking for your gait, and I'm going to do a Romberg's test, okay? So let me get you to get up, and what I want you to do is walk heel to toe, heel, toe, heel, toe, okay? Alright, good job. Let me get you to go back. And let me get you to just walk in a straight line. Now I'll be looking for your arms and balance. All right, good job. All right, so now I'll be... Okay, now I'll be doing the checking your gait. So let me get you to stand up. No, that was your gait. Now I'm finna do the Romberg's test.
All right.
Hold on, stand up. Yeah, so this is the Romberg's test. So what you want to do, let me get you to stand feet together, arms by your side. Let me get you to close your eyes. And then we're just going to move the camera. I'm going to hold you, and then I'm going to let you go for a few seconds, and I'm going to count, okay? All right. All right, good job. Get out of seat. All right, so now I'm going to start with your let's see. Yeah, now I'm going to start with your pain assessment. Do you have any pain?
No, dude.
All right. On a scale of 1 to 10, how would you rate that pain?
5.
All right. And where is that pain?
On my back.
All right. Anything you do that make that pain worse?
Working.
Is it anything you do to relieve that pain?
Painkillers.
And when did that pain actually start?
Like a month ago.
All right, like a month ago. Okay. So lastly, I'm going to do your HEENT, which is head, eyes, ears, nose, and throat. So now I'm going to start with your, now I'm going to check your neck for any problems like with range of motion. So let me get you to move your head like this, ear to shoulder, and now up and down. Does that hurt?
No.
All right, and I'm going to be checking your shoulders for symmetry. I want you to sit up. All right. Have you started any new medications?
No.
Do you have any problem swallowing?
No.
Any dry mouth?
No.
All right, so now I'm going to be checking the inside of your mouth. I'm going to be checking your oral mucosa. And I'm also going to be checking your dentation, okay? All right, let me just look inside. And what I'm looking for is pink and smooth. All right, dentation looks good. No teeth decay. Very good. All right, so now I'm going to hand you a cup of water, and what I'm going to do is checking your trachea. So every time you take a gulp, I'm going to palpate your trachea. So just take a gulp. All right, good job. That was normal. All right, so now I'll be checking your trachea to see, checking for the midline. Right, hold your neck up. So I'm going to be checking that trachea, making sure it's at the midline here. So it is. It looks good. Do you have any headaches? What about a history of loss of consciousness? All right, so now I'll be checking your head and face for general size, shape, and symmetry. All right, your head looks good, symmetrical. All right, so do you wear hearing aids?
No.
Do you have a history of ear infections?
No.
All right, so now I'm going to be checking your outer ear structure, and I'm going to be checking for mucus. All right, your structure looks good. No mucus. Let's see this slow. No mucus. Your structure is symmetrical. That looks good. All right, so let me ask you next. Do you wear contacts?
No.
What about glasses?
No.
All right, so I'm going to be checking your pupil response in light and dark. And what I'm checking for is one eye to dilate 100% and the other to constrict 100% and the other one to constrict 50%. So you want to just look past me and then look at something close to me, okay? So look far behind me. And now close. Look at my shirt, you can. All right, good. Pupils seem equal. No bulging of the eyes. Let's see what we have to do next. All right, do you have a history of loss of smell or nosebleeds?
No.
All right, so now I'm going to ask you to hold one nostril and breathe and do it this on the other side. All right, no blocked airways and everything is good. And one thing I forgot when I was checking your mouth, I checked for your lip, make sure there are no lumps or anything on the lips, and just checking on the inside of the lips, and it looks good. All right, so I'm done with all of your assessments for today. Your doctor will be in with you in just a moment, okay?
All right.
Thank you.
Thank you. I appreciate it.